The following YouTube is going to focus in on using this little stretchy person. It is made of a stretchable material, non-allergic, and has capacity to stretch and stretch, and even stretching the legs independently and stretch. So I offer these to patients, sometimes to even carers as well, and to members of staff, to use as a stress reduction technique focused on the breath. So I begin with using the hands and the arms. So inviting the person to take a breath in as they lift the arms up. And then as you breathe out, you let go of the tension nice and slowly, extending the out breath. So the idea is that you invite the person to take a comfortable breath in, lifting the arms up, creating a space here, extending outwards. So again, breath in, lifting the arms up. And then breathing out, slowly releasing the breath, extending that out breath as the arms retract to the body of the stretchy. So the idea is you do this 4 to 5 times. 5 is a useful number because we've got 5 digits. So again, I'll take you through this. Take a breath in, lift the arms in, up, and then as you breathe out, bring the arms down and down. Let go of the breath. Breath in, lifting the arms up. Breath out, releasing the breath, letting the arms drift down and drift down by your side. So the idea is that you're doing 5 of these. Breath in, lifting the arms up, and then as you breathe out, letting the breath flow out. So a bit like bellows, really. Breath in, and then letting the breath go. So you could count up to 5. So breath in for 1, releasing breath. Breath in for 2, and releasing the breath. And if you find it challenging to breathe in this way, you can always just breathe normally in between. And then when you're ready to go for 3, breath in, and release the breath. 4, breath in, and release the breath. And then finally, number 5, breath in, and letting the breath go. We then move on to the second part, which is to use the legs. And we're thinking about the diaphragm, the largest muscle of the body. And what we're doing is diaphragmatic breaths, but we're using the legs as a way of integrating the stretchy within the breathing technique. So we're breathing in and taking that breath down towards the belly, and then breathing out as the legs come back and back. And again, you're counting up. So breath in for 2, and then release the breath, letting that breath go. Rest for a moment. If you need to breathe in between, do so. And then when you're ready to go for 3, breath in, and then release the breath as you let the legs come back to the main part of the body. 4, breath in, and then release the breath. Finally, number 5, breath in and release the breath. So when I teach this to others, I focus the face towards the person watching. And you might notice that there's a smile on the stretchy face. And so when I take a breath in, I also smile. And when you smile, when you take a smile, it actually opens the nares of the nostrils. So actually it begins that process of taking a nice breath in. So we'll just do that again. Breath in, smiling, and then breathing out, letting go of the tension. So we'll go again. Breath in, smile, and release, letting the breath go. So teach this technique with a smile. It promotes opening of the airways, and it's calming, and it's an opening way of beginning the breath. The stretchy has lots of uses. So you can actually, by squeezing his belly, make the legs drift apart. Breath in, squeeze, and we do jump jacks. And then just let the breath go. So this is a more subtle way of doing a comfortable breath, and it could be engaging in terms of if something's happening with the other hand. So for example, in the scenario where I'm assisting a cannulation, where somebody's having a blood taken, a line put in for chemotherapy, then I could encourage the patient to have this between their thumb and first finger, and then taking a comfortable breath in. And again, we could count up to 5 or even up to 10 while they're having the medical procedure. So, taking a comfortable breath in, squeezing the thumb and first finger together, and then as you breathe out, let the breath go. And you might be noticing as you breathe out, as you soften the pressure between the thumb and first finger, you notice that the stretchy softens with that out breath. So breath in and release the breath. And in a sense, you're actually holding the body, just resting on your finger and thumb. Breath in and release. So again, you're also thinking about, as you're squeezing, smiling, taking that breath in and releasing the breath and releasing the tension. So it can be done very subtly. So someone could have this just resting in their lap without others being aware of it. So it's a very subtle technique of breathing in and then getting this jump jack response. You can also place the soft squidgy head between the thumb and first finger and apply pressure, breathing in, and then breathing out, letting the head reform. So it offers that little bit of resistance as you breathe in. And then as you breathe out, it reforms. So it brings your attention to the space between your thumb and first finger, breathing in, and again breathing out. And you can invite the person to count those breaths upwards. Counting upwards is calmer than counting downwards. It's a very useful little way of using numbers and the breath and becoming aware of the area between the thumb and first finger and using the stretchy as gentle resistance as you breathe in and apply pressure. And release the breath. And of course, it's a very interactive little object, and you can do fun things with it. You can roll, roll and roll. So you're just rolling between the thumb and first finger, turning them over and then taking it out. So it can be a fun, interactive toy as well. Often these are given out in party bags, so kids will maybe be familiar with them anyway, but it's that sort of engagement with our inner child, um, and using it as a way of focusing on the breath. We have used this little stretchy in various research studies, teaching patients with breathlessness following lung cancer treatment to use this in the morning, the evening, or maybe before a strenuous activity. So it's the idea of building up resilience and building up the muscles, the intercostals, the diaphragm, and just self-regulating through using a simple breathing technique with a stretchy person. And of course, you can give your stretchy a name, um, and carry it with you. So it's very portable.